Boston officials report an increase in the number of homeless families. The census taken in December shows the number of those families on the street was up over the previous year by almost 6%. And for the first time since Boston began the annual census, there were more than 2,000 homeless children. There was also an increase in the number of homeless families in congregate shelters. City officials say they'll try to create more permanent housing, reduce the number of evictions, and provide more access to treatment for substance abuse.
For the first time this winter, we counted more than 2,000 homeless children staying in shelters and motels in our city. Think about that, 2,000 very young kids, school-age kids that don't have safety, stability, or security of knowing where their home is.
For family homelessness, everybody knows that the rental housing market is really overheated in Massachusetts with very high demand in Boston, and a lot of families are priced out and in homelessness. So we saw increases, particularly in congregate shelter. I think this Department of Housing and Community Development at the state that controls the family shelter system is trying to get out of placing families in motels, and that's a good thing. But it puts pressure on neighborhoods in Boston like Dorchester, Roxbury, and Mattapan, where more and more families are living in the neighborhoods, but they're in units that are being used as shelter and not as housing.
The overall numbers were up about 3.8%. That's families and individuals. Unfortunately, the individual numbers in shelters were up over 10% this year. They were up last year as well. After 6 years of very steady progress on the individual side, we've actually lost some ground and the numbers are starting to go back up again. So we need to find and build more supportive housing for people who are homeless a very long time. We've got to keep focusing on the folks who are living actually outside on the street and keep trying to bring that number down.
One of the other areas is that we're seeing increased numbers of homeless people that are in hospital emergency room and hospitals. Some of that's probably just the extremely cold winter we're having, but also we recognize that there are a lot of people in Boston struggling with addiction issues, substance abuse, mental health, sometimes co-occurring disorders. We also have an aging population of people with complicated medical needs. And so we see those numbers going up. There's more homeless people in addiction treatment and recovery homes. That's a good thing. But there needs to be a pathway from the treatment continuum of care into housing and a return to the community so that we don't keep filling back up the shelter beds.
36% of the homeless individuals that we saw the night of the census are residents who do not live in Boston. So these are people who lived in other parts of the state and came in seeking shelter in Boston. So, this is a regional, statewide problem. We, in fact, do a very good job in the city of Boston of making sure people are housed and we get resources to them. Our street count number, again, was down this year, and I think that's a testament to all the work we do to make sure that people have a safe place where they can be at night, even if it's not their home. But we obviously have to continue the efforts to make sure there's affordable housing, that we're preventing families in particular from being evicted from their housing, and that when people who are struggling with mental health issues and or substance abuse issues are getting the kinds of services and support they need.